panel at the Geneva Health Forum. To keep in line with all the safety measures in this pandemic, our whole production team is keeping their masks on, as well as keeping a safety distance from each other. Since I'm alone moderating in the studio today, I'm going to be removing the mask to ensure the best possible audio quality. And with that, let us begin to this discussion. Over the last 2 decades, most parts of the world have seen an expansion to medical access and coverage. Yet, in many countries, large gaps remain. And in this current pandemic, we can see that it is a test to achieve universal health coverage. It has become more evident that patients play a pivotal role in this role. My name is Ariane Alcorta, and I will be moderating this session along with Neda Milevska-Kostova, who is joining us from Macedonia. Neda has over 20 years of experience in health research, policy, and patient advocacy. She's currently a vice chair in the International Alliance of Patient Organizations, IAPO, which is a special guest to this edition of the Geneva Health Forum. Neda is also a WHO consultant on health system and policies and a vice president of Health First Europe, which works on improving access to innovative health technologies in Europe. Neda, I now give the floor to you.
Thank you, Ariana. Thank you for these nice words. First of all, I would like to congratulate the organizers for still pulling through this edition of Geneva Health Forum despite all the challenges we've had. And talking about public health challenges, what we are considering as patient constituency, as a patient community, it is not about really the necessity to change the strategic direction, and this COVID pandemic has taught us this loud and clear, but it is rather to really rethink or transform the way in which health and social services are organized, funded, delivered, if you wish. So for the health access and coverage to be truly universal, we need patients to be engaged. And in other sense, we need health systems that are moved away from today's health systems designed across and alongside diseases, but rather health systems that are in essence designed for people and with people. So the patient-centric approach to the design and delivery of healthcare really asks every one of us to, I apologize. So the design of the health systems really asks from all of us to engage patients in all the steps along the entire spectrum of healthcare, from design to evaluation, from research to implementation, health policy to delivery. So in other words, to make the patients from mere recipients to co-creators of health systems. At IAPO, we are very delighted and honored to have been invited as special guests to this edition of the Geneva Health Forum, and to have a chance to organize this session, also to participate in other sessions. For those of us who have not met us yet, IAPO is the global alliance in relations with the WHO, representing over 300 patient organizations in more than 70 countries. We are pursuing the mission of having the patients at the center of the safe and universally accessible healthcare. And to this end, this session really, as the title says, brings lessons from the field. And we have brought you some exceptional speakers, our champions of delivering the patient engagement throughout the continuity of care. And Ariana will tell us a little bit more about the session itself. Ariane, back to you.
Thank you so much, Neda. In this session, we will be providing regional experiences of effective engagement between experts and patients as co-creators and disseminators of health policies and service delivery. We will discuss challenges and potential opportunities to approach the expert-patient interaction across the entire spectrum of healthcare. So with that said, let us introduce our 3 panelists today. Joining us is Karen Alpars Villanueva, a board secretary of the International Alliance of Patients Organizations, IAPO, in the UK, as well as board member of the Philippine Alliance of Patient Organizations. Karen is now devoting her long experience in health advocacy to advancing patients' rights. Angela Gresset is a director of the Geneva-based Association Savoir Patient, ASAP, and a truly dedicated patient advocacy or advocate and educator. Busy Bright is a pharmacist, lecturer, and public health manager. She is CEO and founder of the Live Well initiative in Nigeria. She is an internship preceptor at Harvard School of Public Health and a doctoral thesis co-supervisor at the University of Helsinki, Finland. Busy has spent extensive years as a patient advocacy in the Middle East, in Africa. So before we start, can you mention a bit of a house rules, Neda?
So for the house rules, we would like to really wish everyone to keep your mics on mute so that we have the best of the quality. At the same time, you have a chance to pose questions in the separate chat box at the right-hand side where you can see the screen. So please ask them and we will take them at the end of the session. Thank you.
Thank you so much,
Ariane?
Neda. Let's start with Karen of IAPO. So Karen, health technology assessment is key to formulate safe, effective health policies that are patient-focused. Again, these policies are all about patients and for the patients. So how challenging do you find involving patients in this health technology assessment process in your region, especially during the COVID-19 pandemic?
Thank you, Ariana. So good morning and good afternoon and good evening from Manila. And thank you to the Geneva Health Forum for this opportunity to talk about the patient movement happening on our side of the world. It's been very challenging, but also a great opportunity to educate ourselves during this pandemic. We have seen for ourselves that patient involvement needs to be accelerated for the health system to better respond to patients and to the pandemic. You will see a slideshow of a series of capacity building sessions that we've had at the Philippine Alliance with Patient Organizations. And I'm pleased to tell you that PAPO is the umbrella organization of various patient groups in the Philippines and is a member of IAPO as well as the group National University of Singapore Center for Regulatory Excellence, Capacity Acceleration and Patient Engagement in Asia Pacific. So the patient movement in Asia Pacific is growing rapidly as countries start to implement universal health care. Thus, governments need to do a systematic evaluation of the impact of health-related technologies. The main purpose of conducting these assessments is to inform a policy decision. Therefore, it is clear that HTA and UHC are game changers in our health system. So we've done a lot of capacity building for PAPO, and we've realized that we needed to look at these areas. First is capacity building, and that means teaching patient groups on how to navigate HTA and to use research to build evidence. Number two, we need to do continuous engagement with our government and policymakers. Number three is we need to build stronger patient communities. So the alliance exists for small and startup patient groups that do not have a legal entity to start with, and they're not formally recognized by the government. We know that even if each group has its own focus on disease specific areas, the alliance can be their voice and we can come together on cross cutting issues. And finally, we know that we need to collaborate with other sectors. We need to work using a whole of society approach, and together we'll have a collective voice and action. So, yes, patient involvement in HTA is alive and well in the Asia Pacific region. And what we've learned is that there are varying degrees of capability and participation, which to a large extent is dependent on the strength and maturity of the health system of that country. So we see stronger systems and economies in the Asia Pacific, such as Australia, New Zealand, Thailand, South Korea, Japan, Taiwan, which have greater patient participation in HTA, while those in the implementation stages of UHC, like the Philippines, Indonesia, Vietnam, Cambodia, Myanmar, to name a few, are in the early stages of HTA. We see this as an opportunity to shape the policies in HTA. We see the value in cross-country collaboration, and this is precisely the reason why we convened at AYAPO, the Asia Pacific Patients Congress in 2019. We hope to learn from each other and share our stories so that we can have a clear vision and plan on how we can evolve and help transform our health systems towards patients and people. So I'll stop here and maybe you have other questions later. Thank you so much.
Thank you so much, Karen. You know, very often we as patients think of our caregivers as gods of health, as the people, the gurus of health, really. So, but the truth is, nobody knows more about the patient's body than the patient itself. We know exactly how many times we get that piercing headache or what specific food we ate when we got that really weird allergy. So the reality is, doctors rely on us to give all that specific information so that they can give us the best possible treatment, right? So timeliness, quality, and efficiency of care depends on both patients and doctors. My next question goes to Angela Gresset, Director of l'Association Savoir Patient, ASAP, based here in Geneva. Angela, what is ASAP's experience and how relevant have you seen that communication between experts and patients, as well as the patient's involvement in the continuum of care?
Yeah, one of the things I think many times we as professionals, I am a health professional, we go and from our point of views, from our issues, we consult patients. And I think we really need to go much farther. In fact, we need to have the discussion from the very beginning. What are the issues that are really key for the patients and their loved ones, their families, and then from that point on, involve them from the very beginning, and not only to adapt or to follow up a treatment as we want to. And also, so from now about 20 years, what we have tried to do is really to do that, is to, first of all, gather patients, to make them tell us their issues, and around their issues we gather all professionals and research, and then together we get data, and even the what we call the tools to collect data we build with the patients. We do everything with the patients, and I think this method, we didn't do a revolution, but in fact we managed to have a network, and even without money, even if we are in Switzerland, this network is working for breast cancer since now 20 years, and we really managed to get things going and improving, and everybody together.
Thank you so much, Angela. You know, in my personal experience as a patient receiving care in 4 different countries, I might say the best engagement experience was in my home country, Venezuela. I really noticed that the doctors really went the extra mile to be in my shoes and understand my situation, and then spent extra time to really explain to me from A to Z the treatment that they were going to be providing me with. So, yet, as straightforward as it seems in some places, there are still some countries where patient involvement and its surrounding stigma are a battle that is yet to be fought. Busy Bright, a pharmacist and a founder and CEO of LiveWell Initiative in Nigeria, will tell us more about the hurdles and challenges of patient involvement in Africa. Busy, how do you perceive patient involvement in the healthcare, and what are some key experiences in improving the patient empowerment in Africa?
Yes, thank you. It's a privilege and honor to be here. I want to thank the organizers of the Geneva Health Forum and IAPO for the privilege to be here today. Thank you very much for that lovely question. We do have quite a number of challenges in Africa for the patient, and it actually starts with the verticality in the health system. You know, in the olden days, the health system was very vertical, where you have a one-way communication between the practitioner and the patient. But like you have said, the patient knows better how he or she should be. And so the patient needs to have a voice and have active participation in his or her own care. But in Africa, we have a general practice of verticality where the patient just gets told what he or she needs without more explanation. So what we are doing to break those barriers is to engage the patient. We empower patients. We also try to destigmatize. You can see in some of the pictures in the slideshow, you see this is a focus group discussion in collaboration with the Harvard Chan School of Public Health, where we are empowering women, low income, them to have a say, to not feel ashamed to be a patient. And we're doing that among low literacy people as well as among corporate people because we found that the stigma issue is a general thing all over Africa, especially patients who suffer from infectious diseases like HIV/AIDS, like hepatitis, and even more recently, the COVID-19. People do feel stigmatized and want to hide under the bushel instead of coming out to talk about it. So the first thing we are doing is to empower patients, give them more confidence to come out and talk about their condition. And that way, we're going to have activated patients, and we have started nurturing what we call expert patients. You can see in the slideshow, you see patients in different settings, in the corporate setting and in low income setting. But the funny thing is, there's a continuum across there's a common denominator of stigma, whether the person is educated or not. You'll be surprised, even a top level executive who is hypertensive feels stigmatized and does not want to talk about his blood pressure. So these are some of the things we're doing, trying to douse the air, by encouraging patients to talk about their conditions. And although we do have patient organizations, many of them are not really empowered. So we are empowering patients. We are also trying to train. For example, we have a training program for women in hepatitis, where we are training even very low literacy women to train other women in their own category of literacy. And so the stigma is being taken away gradually, and we are going to end up tomorrow with a lot of empowered and activated expert patients who will come out and be bold enough to speak. And I'll just quickly conclude by suggesting that a forum like the Geneva Health Forum, at a forum like this, and the Apple has done quite a lot. Patients have the confidence to come out and speak as expert patients, but a forum like the GHS would do a lot for patients by giving the patients a voice in a forum like this. Thank you once more for the privilege. I'll stop here for now, and I'm happy to take questions. Thank you.
Thank you so much, Busy. Now, I want to go back to Nada, my co-moderator. As an expert also in this subject, what do you think are some actions that should be taken in, to promote that patient role in policymaking?
Well, first of all, let me reflect a little bit on the three speakers, what they have said, because to me, this was also very, very rich experience sharing by them, and I want to thank the three of them. We have heard on a number of occasions expert patients, and actually even the title of the session is expert patients. So maybe it's good to go back a little bit and explain what that means in the sense of what our colleagues have said. An expert patient is a person that would have knowledge on their own condition or the condition of someone that they care about, that is far more elaborate than what only the medicine offers. And that is linked to what even BC slides and Karen slides have shown. And that includes, and it was also mentioned by other speakers in the previous sessions, includes clean air, that includes the way we eat food, even the access, whether we have the access to clean water or to sufficient food. So all of those aspects are important when we discuss health policy. So it is not only about the access to services, it's not only about the health system, because we all know that the health comes only 20% out of the health system. The remaining 80% are really linked to the way we live, the way we manage our lives, the way we perceive the quality, and the way we actually have access to all these things. And therefore, the expert patients are those that can bring this extra component that the health system alone cannot grasp, not because it doesn't want to, but because it is not mandated to. And the patients whose lives they live every day, 24 hours, they can for sure also serve as experts to other fellows, to other people who share the same challenges of the quality of having a quality of life. In that sense, I would like to really just bring one point that came into the chat from our colleague. Let me just transfer to the other window. David Baran, he's suggesting that for a specific condition of interest, maybe we should try to refer to patients as partners rather than as patients. So in order to broaden up the scope and to broaden up the experiences of others beyond the patient group. And I completely agree with David. And thank you, David, for asking this, because to us, of course, it's not only about patients, but it is about carers, it is about patient advocates, it is about everyone that really cares about the mankind. And this pandemic has shown us that it is not only patients, but it is everyone and everywhere can help in improving our lives and hopefully going back to the normal. So that's what I really wanted to briefly share.
Thank you so much. Do you have any other questions so that our other speakers can respond?
Well, yes, in the chat we've got a few. Thank you. Thanks to all the participants that have been sending their questions. Arifa has been asking, what are the challenges to involve or promote patients in the process of dissemination activities, especially in the low and middle income countries? And I think we have few of the speakers that really can share experience from the field and from the hurdle that we have in the low and middle income countries, mine included as a middle income country. So I would like to first invite BC to share her views on what are the challenges. Please, BC.
Thank you once more. Thank you, Neda. I'm happy that we have the privilege to talk about some of these challenges. There are so many of them, in fact. But I'll start first with the challenge of the lack of a voice. You see, if a patient suffers from an ailment and has no voice, then that's a double jeopardy, double disadvantage. So the lack of a voice starts, because the patient feels impaired, feels stigmatized, and feels gagged, So he or she cannot speak out. And I think the media can come out and help the patient vocalize his or her voice. So that is one of the challenges. Most of the challenges are centered around the stigma. And then another challenge we have is that we, the healthcare practitioners, tend to want to lead the patient in the sense that we think we know what is wrong with the patient, and so we want to be the patient's voice. And so you find organizations dealing with things like sickle cell and several other things, and you find that the leader, the leading voice, is that of a practitioner and not a patient. it is a major challenge indeed because the patient feels voiceless and just queues up after the practitioner. But with the IAPO and with what organizations like ours are doing, empowering patients, we are now activating patients to overcome these challenges, and we're putting the gauntlet we're giving them the opportunity to take up the gauntlet and do the needful. That is, I'm a patient. I need to be able to come out and speak for myself and my peers. And these challenges they are surmountable. For example, I told you that with hepatitis patients, we now have patients that we have trained. We have a program, the Women in Hepatitis Africa, that train hepatitis sufferers, women who are PLWs, they're already living with hepatitis. Some of them are even very low literacy women, but we are teaching them to talk about hepatitis, to help to prevent maternal to child transmission by educating other women, even women who are not yet infected, teaching them that you can avoid being infected by early screening. And if you've been screened and you're positive, you can receive treatment to prevent vertical transmission. So a low literacy woman still does not want her baby to be infected. So she understands the language of vertical transmission and she wants to help to prevent it by teaching other women and by complying with treatment. With hypertension too, we teach people things like wellness behavior and illness behavior, the social demography of health. How people understand that if you say you're not yes, you can't bring in religion and say, in the name of Jesus, I will never be hypertensive. And because they are not having symptoms, they believe they are not hypertensive. But we make them understand that that is denial and that is wellness behavior. And so person who had a stroke suddenly, that was what happened to them, wellness behavior. So we now have more and more activated patients. Last but not the least, we need government to support us. And government can support with policies. Policies that give the patient a face, a name, and a voice. Policies that do not destigmatize. Policies that would, like we have a woman who is low income, low literacy, she's a market woman, but she's a leader among the hepatitis women. That kind of policy that would encourage a woman to come out and speak and encourage her to take up a leadership position even in her local area. So empowering her, giving her a voice. And if a woman is empowered, we empower the nation. So these are the things we are doing, and we are gradually creating a class of activated and empowered expert patients. So this can be replicated. It is replicable, it is scalable, and it is sustainable. So it can be done all over the world. So thank you very much. I hope the world of journalism, the media, would help in promoting expertise. Thank you.
Thank you so much. I would like to ask a couple of questions here before Neda continues with some of the questions from the audience. I would like to touch on COVID-19 and how this pandemic will really change the the patient participation in this era. Really, will it enhance it or will it do the opposite? Can we start with Karen?
Yeah. So I think it's going to enhance patient participation. We already saw that in terms of continuity of care, there was a disruption because of COVID. So patients were very afraid to access care, and it was a real challenge. But I think what patients are starting to realize is they need to be involved because at the end of the day, this will impact the delivery of health, even the development and co-creation of policies. Because what are we seeing? Almost in the entire resources of the government are focused on COVID, but there are so many other diseases that are being left behind, and there are many patients that are suffering. And this is the time for patients to really stand up, um, educate themselves, build their expertise as we are promoting in this session. Um, the patients need to realize that we are not merely passive recipients of care, but we need to be co-creators and disseminators of information. And the more that we know, the better we are able to participate in policy making. Because let's accept the fact that sometimes, in terms of credibility and voice, the patient voice is given very little weight. In terms of patient preferences and needs, it's sometimes laid in the wayside because of other considerations, mostly economic and perhaps even political. So this is really an opportunity, and there's a call to transform the health system, and this is the best time for patients to truly be involved. Thank you.
You said something very interesting, which is the voices of the patient. We talked about it earlier today, as well as the voices of the nurses. How can we shine a light on them as well? So how can we shine a light on the voices of the patient? How can we promote the leadership, especially on the policymaking side? Is there any specific action that we should start doing? Can we start with Angela?
Well, I think there is a long way to go, really. Usually I'm very optimist, but now really with COVID, I have been a COVID patient. So here in Switzerland, for me, it was a very top-down strategy. Like you have a diagnosis, you receive a message, stay home. No instruction but what you can do as a patient. So it was completely, I don't know. There was, for me, and I know other people, I have a very good health literacy. So I did things, I looked for things, I knew things what to do for me, for my husband, and so on. But I think this pandemic, for me, shows what we still see in a very, we talk a lot of patients as partners, but in this crisis, I didn't see patients as partners. So what we have to do to participate in policies, I think we have each one of us in our area really to reinforce that we have to work with the patients for everything, and they are ethically entitled, and also they have things to say. And if we all in our practice we involve them and we show the outputs, the magnificent outputs we can have through patient participation, I think that's the way we can go forth. At least that's the way we managed to do things for breast cancer in Switzerland, and I don't think we are much ahead. I think really I'm very glad that YAPO exists. I think we think we are going to join YAPO, because I really think all patient associations have to get together and to really put forth the legitimacy and also the contribution, the major contribution patients can have to change health. And that's, on my point of view, I'm Brazilian originally, but I think in middle income countries, lower income countries, I've worked in very poor areas, and I think, and also in Switzerland, we can't really continue to treat very big health issues without the whole population.
Busy, would you like to contribute with this one? What is one main action that should be done? I don't know if it's from the patient side, from the advocacy side, from the policymakers, just one action that should be starting from now to promote that voice of the patients.
You're asking me?
Busy, sorry.
Oh,
Okay,
okay,
so
thank you. Well, I would suggest that one action that can help the patient voice will be maybe a joint action between IAPO and the World Health Organization. Since the WHO is the global health body, and IAPO is in very good relationship with the WHO. I think there should be an action plan, a global health strategy on the patient. For example, IAPO, the patient body has come together to say nothing for us without us. So the patients are saying they must be engaged. And the global health system now says healthcare, the health system should be patient-centered. But we need to go a step forward, and we just need the voice. One action should be a call to action by the WHO to give the patient a voice, and it can be a joint WHO IAPO call to action. Thank you.
Thank you so much. Our audience has been giving or providing a lot of questions today, which is why I'm going to be giving the floor now to my co-moderator, Neda. So what else has the audience asked for us?
It is indeed many, many questions. Let me pick up a couple for starters. Let's see. We have a few of them very interesting. What do you think about mental health of individuals during the pandemic period, and how the associations or the patient voice or the patient advocates could really contribute to preventing this upcoming pandemic, if I can call it? So start from Karen.
Well, I think there are a lot of mental health advocates. In the Philippines, we have a very strong advocacy group, and they've aligned themselves to create awareness about the issues. And they've partnered with the medical societies. And in fact, the media has been also instrumental in raising awareness about the disease. So I think both awareness, coming together with like-minded individuals or groups will certainly help that. And of course, the passage of the mental health law in the Philippines, which will institutionalize the creation of programs. So the policy part is also addressed. Thanks.
If I may add from my perspective, from my own country, so far the mental health was really, mental health within the context of COVID was really, really addressed mostly from the perspective of the health providers. So how do we preserve their mental health? How do we preserve them from burnout and so on? Whereas the patients have not been so much in the focus. And I think they needed it because we have been throughout the entire spring, part of the summer, in a very severe lockdown. The new lockdown probably coming as well. So we tend to look up at the more developed countries, whether they have some solutions for us. So maybe Angela, the situation in Switzerland might be slightly different, maybe offering more options for the patients for mental health.
What we try to do in our area, we mainly work with breast cancer, women facing breast cancer. So we try to keep, even with the lockdown, we really try to keep our services because many patients, mainly now in the second wave, they're really, really, really not well. So not people having originally mental problems or mental health issues, but they're which are attacked by other diseases. In fact, they can't reach out normally the support they get. So for example, we have a patient holding um, uh, a coffee afternoon every month, and patients were really desperate because she was not doing these months, and so she had really I think when you have other health problems, if you feel isolated, you have less medical rendezvous. So we really needed to we really needed to put another to keep our net working even during the lockdown, and really put attention to that. Because people can, if you have any other, you can easily not be able to compensate. So we didn't do. I don't know. I don't. Well, I think that's what the cancer leagues, the Catalan cancer leagues, try to do also, and that's the only thing I see at the moment.
Thank you, Angela. So, once again, from the perspective of the patient organizations, and I also want to thank BC for the earlier comment on what IAPA represents and how we can actually move things forward for the patients globally. I really thank you for that from on behalf of entire IAPA, including your organization as a member. In that respect, we try at IPO, we really try to learn from members' experiences and to try to make twinning or exchange between different organizations to learn about their needs and to be able to advocate globally and be able to help them themselves to advocate at the national and local levels. So in that sense, what do you, all three of you, or whichever wants to take the floor first, what do you see as the next challenge for us as patient organizations beyond COVID? From my perspective, it is, yes, whatever we call a non-COVID at the moment represents a huge challenge, like the NCDs that have been put at the second plan. Due to the COVID focus, many patients have been individually lacking care because of the fear, as Karen mentioned, or because of the lack of resources and so on. So we might be seeing, at least in my country, we will be seeing for sure pandemics or rising number of cases, especially in children with chronic diseases, because the parents have been really scared to take the children to the hospital for their diabetes or for lymphomas and so on. What would your anticipation be of the next challenge that we as patient organizations need to develop toolkits and advise and prepare our fellows across the globe after COVID? Maybe BC, do you want to start first?
Okay, thank you. Post COVID, the first thing we anticipate is that well, I'll speak from experience. We run a health post in a low-income community, and the first thing that happened with COVID was that the babies were no longer able to get their immunization. The pregnant women were not able to get the antenatal care, and they started going back to the traditional birth attendants, whom we've been discouraging them from patronizing. And so it's like making a backward movement in terms of the gains of advocacy and the outreaches. We found that we were losing out on some of those. So the first thing we anticipate is that there's going to be quite a large number of patients who have either missed their immunizations as children or even older adults who have been defaulting, diabetic patients who are well controlled, whose sugar levels are no longer well controlled, hypertensive patients progressing into stroke, and so on and so forth. So it looks very gloomy, but I think that as patient organizations, we can, it's like moving against a train because the COVID-19 is a train, it's a moving train. But we could move at a low velocity, tactically, against the train without really being on the rail track, but aside, safe enough to move against the train without being run down by the train. And what we are doing in that sense is this. For example, if you look through those slides we showed, we have a home care, the Easy Health Home Care, which we had to discontinue it temporarily when the COVID-19 started. So we have just reinstated that this month. So we are gradually reinstating services. The Lagos State government invited us to start again with the antenatal services and vaccinations, immunizations for the children. And so we are gradually reinstating services while maintaining COVID protocols and safety and all that, IPC. We are also gradually teaching communities how to maintain IPC, infection prevention and control, but and also giving them the wherewithal because many of these communities are poor. So we give them the sanitizer spray, teach them how to use it, give them in gallons, so the community leader can share it out to people, and then teach them to use the basic soap and water and so on. So I think that although there will be a lot of negative fallout, it is not unsurmountable. It is for us as patient organizations to let people know that the problem is not unsurmountable. If we continue with the COVID protocols, don't abandon the COVID-19 protocols, hand washing, etc., then let us gradually start to reinstate our healthcare services. And then for the patients themselves, as a patient, if you are hypertensive, remember you can check your blood pressure, you can still take your low salt diet, you can do the things you need to do to help keep your blood pressure down. And you can start coming feeling safe to come back to the health system without feeling scared. And then for the mental health aspect of it, we need to also work out things that will help people to nurture their psyche because a lot of people have lost their income and so they're very, very agitated and angry and so on. So the resilience, the COVID resilience theme is something which patient organizations may also need to start thinking of. It may be a small thing, but it will be impactful enough to go a long way. So patient organizations can start thinking of doing resilience also for some of their members and for communities that are low income. Thank you.
Thank you, BC. I'm not really sure how we stand on time, and there are a few sessions following this one.
We still have about
So I would
13
really have
minutes.
to.
We still have about
Oh, we
13
So
do?
minutes,
I'll take
Neda.
Oh,
so Ned,
okay,
I'll
okay. Thinking that it is 4 o'clock. Sorry about that. Karen, what would you say? What
yes.
is the challenge awaiting us as patient organizations, please?
So we just learned that there are already two effective vaccines that have a very high efficacy rate. So the challenge that I see is actually vaccine hesitancy. In many places around the world, anti-vaccination has been rampant, including in my country. So even with the advent of these vaccines, I see that it's going to be a challenge for vaccination to be implemented, and also because of um, uh, the great demand for vaccines, that also remains to be a challenge. Aside from the issue of hesitancy and the equitable distribution and access to these COVID vaccines. Thank you.
Yes, that's very interesting actually, because this week and the last, we've seen two possible or potential vaccinations that are 90 to 95% effective. So how are we preparing for this? We discussed also earlier in the day about the workforce and the nurses, if they're ready, but are patients ready? How are we going to really vaccinate all of the patients worldwide? Is that even possible? And how are communities or the poorest communities going to be affected? So can we start with BZ with this one?
Thank you again. As regards the vaccine and vaccination, it is really great that we got very good news in the past week. But like Karen said, there's a lot of vaccine hesitancy. I actually belong to an organization that is trying to educate people on the importance of vaccines. And we have found that the one of the fallout effects of the COVID vaccine concept is that even prior vaccinations that people were taking, they have now become hesitant even to continue with the former vaccine. So the
Yep.
vaccine hesitancy is a real issue which needs to be addressed because if the hesitancy is not addressed, the major challenge of getting people vaccinated will not be overcome. And unless they make it, they promulgate laws and acts in various countries to mandate people to get the vaccine, and you don't want to do that. However, even if they mandated people to get the vaccine, how logistically possible is it to vaccinate so many people? One of the vaccines, for example, should be kept at a temperature of minus 75 degrees Celsius. How logical is it to preserve a cold chain at minus 75 degrees and preserve the integrity of the vaccine to the point at which it is administered? So these are all very important and impactful challenges that need to be clearly addressed before we know that. So I would say it is not yet Uhuru, but we are on the path to progress, and more progress needs to be made. More information needs to be disseminated out there. And the media is a very, very important partner to the patient and to healthcare globally. So I'm sure the media would help us with this. Thank you.
Thank you so much. Angela, would you like to chip in that question?
Yes, in fact, of course, there are all those questions, but for me, I'm really reluctant to all those really top-down campaigns with no transparency about the information. And before saying how are we going to get everybody to be vaccinated, I think we should inform the population, but really with transparency. Do we have transparency at this moment? I don't know. But I think COVID is not only a problem of a vaccine. Maybe the vaccine will do it, but I think we, if we are talking nothing about us without us, as is the slogan of Yapo, and it's more or less our slogan also. I think we should, it's really also the way it's going to be put and explained to the population, and how the population is going to adhere or not is a second question. For me, there is a very, very big ethic issue to be considered at the bottom line.
Thank you so much. Karen, would you like to say something about it? Do you feel the same way as Angela?
Well, I think for us, the issue is being able to access the vaccine. We know that government funds are limited and they will be allocating budgets for the lower strata of our society. So, what about the rest of the population? I think it's an issue of giving the patients a choice whether they want to be vaccinated or not, but at the minimum, being able to provide that protection. Because as we have seen, of course, the other health protocols still need to be in place. We're not saying the vaccine is the be all and end all, but it certainly offers protection for the patients, and uh, we need government, we need the other countries, the other sectors of society to be able to provide equitable access to the vaccine, especially to the lower and middle income countries. Thank you.
Yes, especially in the cost. Also, we need to make sure that it is accessible to anybody that wants it. As you said, not many people would like to have the vaccine, but for everybody who wants it, it needs to be accessible, affordable. I don't know how if it's gonna cost something, or are patients gonna be able to get it for free? What do you think about that, Neda?
Well, first of all, before going to the costs, I think another role that the patient organizations can play is to really be involved on the discussion table about the vaccines, in the sense of which tiers of the population these vaccines the vaccine can be administered to. And by this, I don't really mean only the social class, which was mentioned, but I mean the diversity, the different diseases, some of which are really contraindicated for any kind of vaccination. So we also need to understand, as patient organizations, what are these groups of population or types of diseases for which the vaccine might not be indicated straightforward, and for us to communicate, to prepare relevant materials to communicate with other patients and with other patient organizations, so that we don't really come into position that governments or anyone else is blamed for not providing the vaccine to specific groups, because sometimes out of medical reasons the vaccine cannot be immediately administered to some patients. For some patients, they might not even be ever possible to be administered. So by this, I think that the patient groups really need to be more engaged with the governments and with the global health agenda leaders to understand and to really provide our inputs into the debate. Now, on the costs, that is another role that the patient organizations can undertake, and it is, as Karen said, it is very difficult to expect that, first of all, number of doses will be available readily. Secondly, that the funding will be available even if the doses are there. However, as patient advocates, as patient organizations, we need to as well understand and fight along these lines, so that at least the most vulnerable are covered. Again, as I said, those that are not in the front line for immunization to be in other ways protected, meaning by social policies. For example, there are patients who cannot be administered vaccine, for them to have a special social assistances that can provide them work from home and so on, so that they can still contribute to the society. And those are also patients that are really being part of the society and contributing to any of the economies across the globe. So in that sense, the cost itself, we cannot say at the moment how much would it be. We do not, of course, wish that any patient pays out of the pocket. It is not their responsibility, because the health should be a global responsibility and should be our joint public commodity, public good, because the health really contributes to the betterment of our economies and to the welfare of our nations, to the better quality of life. So in that sense, just to summarize, for me, there are two key roles patient organizations can play. One is in really defining what are the patient groups that can or cannot receive the vaccine, and work with the patients across the globe to get the understanding. And second thing is to really advocate with the governments and work together in providing the vaccine gradually to the most vulnerable, to provide for equity of all the patients, and of course, to the health of everyone.
Thank
Thank
you
you.
so
I
much,
also
Neda.
wanted to add, Ariane, I also wanted to add the aspect on safety. So it's also important that post introduction of the vaccine, that safety and monitoring is extremely important. And the patients can play a role by reporting adverse events and ensuring that these are reported in the manner that are that their regulatory agencies have mandated all these protocols. Thank you.
Thank you so much. I want to thank you all, you as participants, for your vivid explanation this afternoon. And of course, to you also, Neda, for your participation. It was a pleasure to have you as a co-moderator. Up next, I would like to tell you that you will have a time to enjoy a stretch time to clear your mind and watch a yoga session provided by the Indian government. Thank you so much for taking the time to listen to us. Up next, in half an hour, we will touch directly on the present health crisis and how it's affecting universal health. So stay tuned.
Dear friends, on behalf of the Ministry of Ayush, Government of India, I welcome you to this short yoga session. We will do 3 yoga exercises which you can easily practice sitting in front of computer screens. Let us start the session. Hand raising pose. Precautions. Person undergone recent lumbar, shoulder and abdominal surgeries should not practice this asana. Practicing method. Sit straight. Keep your neck, back erect. Breathe in and slowly raise both the hands from the side above the head. Interlock both the fingers and twist the fingers towards the sky. Stretch and pull the shoulders upward. Maintain the posture for few seconds. Slowly breathe out. Turn the hands. Release the fingers. Bring both the hands to normal from the sides. Repeat this for 2 to 3 times. Benefits of this asana. Stretches the muscles between the rib, strengthens muscles of shoulder and abdomen, improves digestion, relieves from shoulder pain. Lateral bending pose. Precautions. Person undergone recent lumbar, shoulder and abdominal surgery should not practice. Practicing method. Sit straight, keep your back, neck erect, keep both the hands comfortably on respective knees. Slowly breathe in and raise the right hand from the side above your head. Palm facing towards the left side. Breathe out and try to bend towards left side as much as possible. Maintain the posture for few seconds. Then slowly breathe in, raise your hands to the normal, breathe out and bring down the hands. Practice this from left side. Repeat the practicing for 2 to 3 times. Benefits: stretches the muscles between the rib, strengthens muscles of shoulder and abdomen, improves the digestion. Now we will practice pranayama, deep breathing exercise, anuloma viloma pranayama or alternative nostril breathing. To practice this, sit comfortably. Keep your neck back straight and erect. Place your left hand over the left thigh. Adopt Nasika Mudra from fingers of right hand. Close the right nostril from the thumb and slowly, deeply breathe in from left nostril. Close the left nostril from the middle and ring finger. Slowly and completely breathe out by releasing the right nostril. Repeat same from left side. Breathe in, breathe out. Practice this for 5 to 7 rounds. Benefits: relieve from the stress, pain, improves concentration, conserve the energy. Thank you for practicing. Enjoy the GHF session today. For any queries, please reach out to Embassy of India, Bern.